بسم الله الرحمن الرحيم. في البداية أنا بشكر أستاذي الأستاذ الدكتور محسن إبراهيم والأورجنايزنج كوميتي للمؤتمر جامعة الزقازيق بلدياتي وحبايبي. بسم الله الرحمن الرحيم. كده واضح يا دكتور سليمان؟ النهارده الكروس توك between brain and kidney for regulation and dysregulation of hypertension. A definition in the crosstalk is generally defined as endogenous homeostatic signaling between vital organs such as kidneys and brain. Under physiological states, the nervous system and the kidneys communicate with each other to maintain normal blood pressure. The role of the renal nerves in blood pressure regulation. Renal mechanoreceptors and chemoreceptors sense changes in the kidney and they provide sensory information to the CNS through afferent fibers. The afferent fibers synapse with the neurons that project to the cardiovascular nuclei involving in blood pressure regulation. They coming from the CNS through
دكتور عبد المنعم
نعم.
لو سمحت اللي معاه موبايل يقفل موبايل. لو سمحتوا اللي معاه موبايل يقفل موبايل.
The coming fibers from the CNS to the kidney is the afferent fibers, sympathetic neurons. These sympathetic neurons synapse with the preganglionic neurons. And within the sympathetic ganglion, these fibers synapse with renal prostoganglionic fibers that innervate renal tubules responsible for sodium reabsorption and vasculature that regulate renal blood flow. And through the juxtaglomerular apparatus, there is release of renin fat. The sympathetic nerves innervate from this figure, previous figure, sympathetic nerves innervate the whole renal vasculature with the most dense innervation to the afferent arterioles. Norepinephrine released from the sympathetic nerve terminals can directly act on the renal vasculature and the tubular epithelial cells. Increased efferent renal sympathetic nerve activity increases renin secretion, decreases urinary sodium excretion, and decreases renal blood flow. In normal blood pressure, the sympathetic nerves alter renal blood flow and GFR via renal vasoconstriction and alterations in the RAS system. In the normal state, renal afferent sensory activity leads to a reflex decrease in sympathetic outflow, which is known as an inhibitory reno-renal reflex. Renal or autonomic dysfunction is the predominant contributor to systemic hypertension. The increased sympathetic nerve activity coming from the brain to the kidney and the renal afferent nerve from kidney to the CNS activity to the CNS contribute to hypertension. In hypertension, the renal reflex is impaired, and an increase in renal afferent activity augments the sympathetic excitation to the kidney and aggravates hypertension. The renal reflex. The two kidney, one clap model of renovascular hypertension, the afferent activity from the contralateral kidney leads to inhibitory renal reflex to the ischemic kidney as occurs in normal kidney through inhibitory reflex. Increased afferent activity from the ischemic kidney leads to an excitatory reflex that augments the sympathetic outflow in the contralateral kidney, contributing to hypertension. ده اللي بيحصل في ال2 kidney 1 clip، وده بيثبت ان السيجنالينج اللي طالعه من الكونترالاترال او من الاسكيميك بتتحكم يا اما في ان يبقى في نورمال بلاد بريشر او هايبرتنشن. clinical relevance. at 2015 renal denervation has been used as a novel therapy for resistant hypertension. Ablation of the renal nerves was shown to produce a long-term reduction in blood pressure in resistant hypertensive patients. At 2019, in scientific reports, 15 randomized control trials showed no significant benefits of renal denervation on blood pressure control in patients with resistant hypertension. Recently, at 2020, sodium glucose cotransporter 2 SGLT2 inhibitor induced sympatho inhibition. Chemical denervation in neurogenic hypertensive mice reduces renal SGLT2 expression. SGLT2 inhibition lowered blood pressure and significantly reduced norepinephrine levels in the kidney of neurogenic hypertensive mice. The crosstalk between the sympathetic nervous system and SGLT2 regulation appears as a key mechanism of the cardiorenal protective effects demonstrated with SGLT2 inhibition. There is a crosstalk and cooperative oxygen sensing by the kidney and carotid body in blood pressure control. Acute and chronic hypoxia is sensed by both kidney and carotid body that activates afferent nerve signaling, promoting reflex increase in the sympathetic nerve activity, triggering hypertension. Hypoxia-mediated renal and carotid body afferent signaling triggers uncontrolled activation of the RAS system. In renovascular hypertension, renal and carotid body mediated responses in arterial pressure appear to be synergistic as interruption of either afferent source has a collective effect of reducing blood pressure. Mr. Chairman, dear colleagues, our conclusions: sympathetic nerves innervate the whole renal vasculature with the most dense innervation to the afferent arterioles. In the normal state, renal afferent sensory activity leads to a reflex decrease in sympathetic outflow. Renal or autonomic dysfunction is the predominant contributor to systemic hypertension. In hypertension, the renal reflex is impaired, and an increase in renal afferent activity augments the sympathetic excitation to the kidney and aggravates hypertension. Hypoxia-mediated renal and carotid body afferent signaling triggers uncontrolled activation of the RAS system. Sodium glucose cotransporter 2 SGLT2 inhibitor induced sympatho-inhibition. And thank you very much for your attention.
شكرا للاستاذ دكتور عبد المنعم ابراهيم. Any questions؟ دكتور سليمان.
دكتور عبد المنعم طبعا كالعاده محاضره ممتازه و to the point. How to explain the failure of denervation of the renal blood vessel to control blood pressure?
How?
We have two controversy. The first papers showed that we can denervate the renal blood vessels and to control blood pressure. Then, after many papers, they deny this effect. How to explain this conflict?
الحقيقة الاكسبلانيشن ممكن يكون في التكنيك نفسه. في التكنيك هل الدينرفيشن كان شامل كل النيرفس ولا لا؟ وبعدين هل يعني احنا بنشوف في النيرفس سيستم بعد ما بتتقطع بيحصل لها ري اكتيفيتي في بعض الاشياء. والحقيقه ان المالتيبل سيستم ريفيو اللي هو في سنه 2019 شمل عيانين كتير جدا وقال انه مفيش بنفيت منها، وفي استادي تانية احيانا البنفيت بيقعد اسابيع وينتهي. فدي اعتقد ان ممكن تكون الانرفيشن التكنيك بتاع الانرفيشن ما كانش كامل. نمرة 2 ان ممكن يحصل ريكفري جروينج للنيرفز تاني.
هو في الاستادي كانوا بياخدوا 6 بوينتس في اول استادي الموجوده فيها واللي هي جابت افكت، وفي الاستاديز اللي هي فيلير كانوا بياخدوا برضه 5 to 6 بوينتس. فاعتقد ان لسه النتورك اللي موجوده احنا ما نعرفش الديستريبيوشن بتاعها، هو ده السبب. يمكن باي تشانس في الاول كانوا عملوا جود دينرفيشن فعشان كده جايب الايفكت بتاعها. فاحنا محتاجين نعرف السمباثيك تشين وديستريبيوشن فيها قد ايه. اعتقد كده يا دكتور.
ممكن تعليق for my opinion from the sympathetic nervous system overview, the role of sympathetic innervation of the kidney vessels is of little importance, not so significant like other arterial and arterial system all over the body. If the sympathetic overactivity in the kidney increase will induce ischemia. So under normal condition, sympathetic activity over the renal blood flow is of limited role of low effect. This is my opinion. So the denervation of the sympathetic nervous system of the kidney has a little role in management of hypertension.
الفلور، حد عايز يسأل دكتور عبد المنعم أي أسئلة؟ شكرا دكتور عبد المنعم، شكرا
شكراً.
جزيلا.